Yeah, good.
Thank you. Well, welcome everyone to the Health and Rehab Sciences group for the U21 annual group meeting. This session, we're really excited to bring together a range of presenters to share our digital learnings from our COVID world, but looking forward in a future-focused way to what we can take with us to a post-COVID learning and the education that we have in the health and rehab sciences. So the format for this session will aim for about 50 to 55 minutes. We'll start off just with some admin and housekeeping. And then we're really delighted to have our invited presenter, Ben Ellis from the University of Birmingham. And he will be presenting and sharing with us the Global Health Challenges project and the digital modules that he has been developing in collaboration with some university partners through the U21 network. After that session, which will be about 15 to 20 minutes, including some brief Q&A, we'll then share some of our learnings and insights from our digital strategies toolkit, and that will be some members of our core group who will be sharing one slide each in about 5 minutes to talk about their learnings and what we might be taking forward with us. And again, this is in the spirit of a trade show, so suggesting some learnings and also learning from others and what others are able to bring some tips and tricks. We'll then wrap up the session with a summary and a close. And as I mentioned, within the hour, looking at about a 55-minute session. So just to set the scene, in our health and rehab sciences context, our pre-COVID learning might have happened in specialised clinical simulation facilities or laboratories, practical rooms, gyms, all sorts of facilities. However, of course, we know that during the COVID pandemic, we have had some disruptions to our access to those face-to-face learning opportunities that we've relied on so heavily for many years in our education space. And we've often needed to shift quite rapidly to the home environment or helping to facilitate learning offshore for students who aren't able to gain access to our on-site facilities, or even during periods of snap lockdowns, for example, or extended lockdowns, and needing to support that learning into the home. So although this is a broad brush summary of what the disruptions have been, and there's some nuances, of course, into what that looks like for each individual course or program or clinical education context. But really from these disruptions and challenges, we've seen that there are a range of opportunities and indeed some wonderful solutions that people have developed. So this then will be our toolkit, and this will be looking at how we can share some of these learnings with each other. So just to acknowledge the members of our core group, and you'll see on the slide there, and our happy memories of this photo was actually taken at the University of Glasgow 2 years ago now, when we were fortunate to have a face-to-face meeting, but we've continued our links and connections since those times into the online space, and it's really served us well to be able to continue to connect remotely across the globe. So we'll hear from these wonderful members of our team during our toolkit presentation. Just some Zoom housekeeping. As you can see, we are in a live Zoom session. So as you are now, if we're able to be on mute, and during the presentations, we'll each have our camera off apart from the main speaker, and that will help just with the bandwidth. We do welcome your questions or comments using the chat function, or of course during the discussion session at the end. If you're comfortable and able to do so, we encourage you to turn your camera on and unmute and ask questions or contribute to the discussion in that way. And also finally, so that you are aware, we are recording this session, and that will be available on the U21 site. And a shout out to those people who are viewing this asynchronously, and we hope that this is a helpful session, and thank you for viewing. So I will now, I'll stop my share and I'll hand over the Zoom mic to Ben Ellis from the University of Birmingham, and we look forward to hearing from you, Ben. Thank you. Just stopping share now. Over to you.
Okay, great. Thank you. Thanks for
inviting me to speak, and just let me going to share my screen and get us up and going. Okay. So yeah, I'm going to be talking about the Global Health Challenges digital module, which was one of the projects funded as part of the U21 Global Education Enhancement Fund. And it's a collaboration, as Alison said, between 5 universities in 4 countries. So we've got University of Birmingham, which is where I'm based. We've got Tech de Monterrey, our hosts, obviously at the minute. We've got Queensland and Melbourne in Australia, and the University of Johannesburg. So the aim, well, where this sort of started from was an idea about wanting to see whether we could provide some opportunities for healthcare students to get a different perspective on the healthcare systems in which they work. Because what we tend to do is we train people, we educate people to work within a system. And so we spend most of our pre-registration education certainly within one system. And whilst people may go and work in other systems sort of further on down the track, it's not something we always think about in our sort of pre-registration qualifying programs. But obviously the healthcare systems that people exist in have a huge impact actually on the care and the sort of the health outcomes that they might experience. So it was about trying to sort of think about how we could make students more aware of that, see these differences, see that different systems are out there and exist, and see how some of those systems globally can both create and sustain inequality. And that inequality might happen within one system or between systems. So that was the background. There was something that I'd been sort of tried on a smaller scale before, and this was an opportunity to sort of broaden that out and use the reach of the Universe 21 network to sort of bring a wider number, I guess, of different voices into this. And we're keen to use then sort of digital ways. Obviously, we're so used now to Zoom and to all of these processes of talking to people around the world. It's so much easier to do that and provide a really hopefully quite engaging internationalization experience as part of the curriculum for every student. Because again, I think one of the challenges with these sort of things, thinking about global health, thinking about differences between countries, is that there's always a subgroup of students who are really interested in that, and they'll seek them out, and they're the students who might take up opportunities to go and travel abroad and study in different places. But I think there's really something valuable in trying to give that sort of insight and that sort of different perspective to the whole cohort. So that was what we're trying to think about. Can we do that in a way that is interesting and engaging for students? So the plan, the aim of this project was to come up with sort of 2 modules really that are very much centered around the individual. So we wanted the people with different healthcare conditions voices to be at the heart of it. So they're based around case studies, which involve both interviews and sort of recorded capturing aspects of people's lives. And that might be elements of a clinical encounter. It might be where the person lives, some of their sort of social context that they're in, so that we're getting a sense of sort of some of those differences and how those things might play out internationally. We decided to focus on two conditions. First one being type 2 diabetes, and the second traumatic brain injury. And the reason for that, partly kind of the interest of the people involved, but also we wanted to think about a long-term condition and how health systems might organise themselves to try and support somebody with a long-term condition, and also more of a rehabilitation pathway and a sort of journey that happens after something that's quite a shock and a change in someone's healthcare situation. I just wanted to acknowledge it at this point. So what I'm doing here is I'm really giving you some of the background to the project and the sort of the point that we're up to in this. So there have been a number of challenges, as I'm sure everyone has experienced in all number of projects over the last 18 months, particularly around COVID, both the impacts on members of the project team and also in terms of trying to get access to the people who we wanted to be at the heart of it for the case studies, without putting them, at any increased risk, and sort of manage how we do that. So there have been some challenges there, you know, and also some challenges, and it's really opened certainly my eyes to some of the problems that we might have when we try and do sort of person-centered health-related educational projects between countries, because certainly one of the things that sort of cropped up was around sharing data and information about somebody's health between different people in different organizations through this umbrella of Universe 21, and that's yeah, there's definitely been some learning and some things highlighted there. I'm happy to pick up on those if people are interested. So to give you a bit of an overview about what the two modules are planned to and are kind of coalescing around looking like. So the TBI module, I say it looks at the rehabilitation journey across sort of 4 time points really. So in the very acute phase, when someone's likely to be in like intensive care, to the subacute stage, probably still in an acute hospital, but sort of progressing down that level of immediate clinical need, and then into rehabilitation, and then in what the longer term care looks like. So we're sort of spanning this all the way through to sort of 2 years plus post the accident, to see, well, how does the healthcare system support someone? Where does this care happen? Who pays for it? What are the gaps there? And what are those? How are those things different between the different countries where we're taking these case studies from? So it's looking at a comparison of both the international guidelines, so what are people trying to achieve with their care, also international data about what the impact and the burden of these sort of conditions looks like, and then fitting that with what the individual experience of the people who are going through that system is like, and where we really want the students thinking to be is towards a consideration about the barriers to access. So what is stopping, what's preventing people being able to get access to the rehabilitation that the system is trying to give them, that the guidelines suggest is going to be helpful, but we know that obviously often people are going to get quite a varied sort of amount of all the care that they could possibly have. So what impacts that? I've got on the side here that there's obviously one thing that is an example of a guideline that's sort of showing what that flow might look like from some of the UK guidelines. And I also wanted just to bring in here and talk about the Sustainable Development Goals. So we're trying to link across to several of those and some of the specific targets actually that link into those, because there are targets around reducing deaths from long-term conditions such as diabetes, and also around things like trying to reduce road injuries and deaths, which obviously pulls in to some of the sort of mortality and morbidity that we might see associated with some of the causes of traumatic brain injury. Diabetes module, similar, but rather than following a timeline, it's looking more about how a long-term condition is managed. So we're thinking again about what the national impact is. Again, I've got here 2 pictures from this fantastic visualization tool. I don't know if anyone's used it before, but it's the Global Burden of Disease visualization hub. And you can put in all sorts of things and get all sorts of incredible pictures and infographics and stuff out of it. And these ones show, I think the top one is from Mexico, and the bottom is from the UK. It's looking at what all causes of mortality were in 2019. So you can see the differences of a condition like diabetes and how much of a burden that's having, both from a mortality but also from a disability adjusted life years, all sorts of different sorts of information in there. So thinking about the overall impact of the condition, and then sort of 3 particular parts. So the monitoring and the review of someone's care, their medication that they might be on to try and help control their diabetes, and the sort of lifestyle changes, you know, that they're encouraged to make, and sort of how they're able to make those lifestyle changes given the social context that they're in. And again, the same themes are there across sort of both of the modules. So it's trying to get some comparison of what the guidelines suggest we should be doing, what the data looks like in each country, but really with at the heart of it, the individual experience. So what are people telling us it's like to try and do these things? How do they actually experience it? Are they getting, you know, what the guidelines might suggest? So that as students and as healthcare professionals, we're thinking about, well, what are the barriers to access in my healthcare system? You know, why isn't everybody getting everything that they could be getting here? But also, how does my healthcare system look compared to others? And are there particular barriers that we have that someone else doesn't have, or particular things we could learn across? So it's really trying to sort of think about that, and with the aim to sort of get students to think about, well, what might a perfect utopian healthcare system look like? Is there such a thing? And what can we learn from other places? So I thought I'd just give some examples of sort of some of the things that are going to make up the e-learning module. So there's for the diabetes side, there's sort of 2 tracks, and this is the module that is further along. So we've been able to record pretty much all of the case studies for this. The TBI one has had more difficulties, and so that's a bit further behind with where we're up to. This is an example then of a sort of infographic we put together that looks at what the recommendations are from the guidelines in Mexico, Australia, South Africa and the UK for how regularly things should be monitored and how often people should see a healthcare professional. And what you can see generally, and this is the pattern across all of the things that we looked at, the guidelines really don't differ that much at all. There are slight tweaks and differences here and there, but these are evidence-based. The evidence doesn't change. It's international, and sometimes we can think, because the evidence comes from international sources, that our healthcare practice is sort of necessarily international in its outlook. And the guidelines certainly sort of would support that view. But then once we get on to actually what does it look like, how does the healthcare system try and provide those outcomes, then it starts to look quite different. So for example, what we did is capture some of the healthcare costs from the people involved in the case studies. So we can start to see how does it look, what does the healthcare plan look like, what's someone paying on an annual basis into to get that healthcare. In some instances that's really clear. Sometimes it's about a private insurance or a social insurance kind of model within the country. Then in other countries, like in the UK, it all comes out of general taxation. So it's really opaque and hard to get a sense of how much any of the cost is. Sometimes there are costs that are attached to specific aspects of care. So people might have to pay for a review appointment or for the equipment that they might use to do self-monitoring of their blood glucose. Whereas in other healthcare systems, that might be provided as part of the sort of overall package of care. So it's getting students to think about, as I say, that there are differences here. And, whilst it might initially seem appealing to just go, oh, that one's free, that must be the best way of doing it. Is it necessarily? What are the downsides to a system that tries to provide things for free compared to a system where people have much more of a clear idea what they're paying for, and so are their expectations do they change? I'm just going to play then a short snippet. So that's sort of what the students would do is go through a page that's sort of looking at, giving some of that background and some of what the guidelines looks at, and then with some snippets of some of the case studies that we recorded. So I'm going to be quiet for a minute and just play this short clip from a couple of our case studies.
I am due for a diabetic review once a year. The last one was over a year, partly through the pandemic. They check blood pressure, temperature, they take blood, feet are checked.
Cuando llega usted, llega a esta sala de espera, se sienta y ¿qué es lo que...?
Llego con la recepcionista y le entrego mi tarjeta, le digo, tengo cita. Y ella le checa, me siéntese, y luego me habla a pesarme.
Ajá.
Y ya después ya me habla.
¿No hay una enfermera que le tome la presión antes de la consulta?
Me lo toma la doctora.
¿Dentro de la consulta?
Dentro de la consulta, la presión. Ella nomás me pesa, la recepcionista.
Bueno, entonces no hay ningún personal de enfermería al momento de que usted llega a la clínica. En la sala de espera.
Nomás la recepcionista y la doctora.
¿La acompaña a alguien cuando va a sus citas o va sola?
No, es mi esposo, y si no hay nadie me voy sola.
¿Cuánto tiempo dura su consulta?
Dura yo creo unos 15 minutos.
¿En ese tiempo usted considera que la atendieron bien, que se vieron todas sus necesidades?
Sí, me atiende muy bien la doctora porque me checa la presión y me dice que a pesar de que me da la receta, tómese así las medicinas. Y si salió un poquito mal esta vez de la diabetes. Y que comió y ya me pregunta, ya le digo, y me subió un poquito la insulina, ponía 20, me pongo 30.
I am due for a diabetic.
I'm struggling to get off that slide. Now there we go. So as I say, that's an example of sort of 2 little snippets that give a bit of a sense of people talking about the same condition, the same kind of review process in a couple of different countries. Obviously, we've got larger clips that the students would work through. But what you get a sense of is that there are similarities, and actually often around the care in terms of what takes place, that's where the sort of greatest similarities are. But there are bigger differences around like the funding and, you know, the sort of wider social experience of what's included, and the barriers, particularly around things like diet and physical exercise, physical activity, and what some of those the challenges for that might be, for different people, either within the same healthcare system again or in others. So having sort of watched this, got a sense of people's experience, then the idea is that students have to interact a bit with students from other healthcare systems. And we're piloting two approaches here. So the first one is a synchronous approach, so group discussions over Zoom, where you've got both a discussion between students from the same healthcare system, thinking about what the sort of strengths and limitations might be of their system, before they go into a group conversation with a group of students from another university, to talk about, you know, again, what the varying strengths and weaknesses might be, with an aim of thinking towards, again, what might this sort of utopian healthcare system look like? What could we take, you know, do we want to do we think either of our systems is good? Could we do something better? For the other side, it's an asynchronous activities. So again, we're really interested to see sort of how does that work, because obviously is a big challenge in setting up synchronous discussion. That takes time and effort, particularly if you're trying to do for a whole cohort. But asynchronous activities using some apps like discussion-based things that can be embedded into the platform allows students to explore some of those questions with students from other countries without needing to do it at the same time, and it may be a way to get more on. So we're going to try both, and then have a look and sort of evaluate the two ways of doing it. And again, I just got up here one of the Sustainable Development Goal targets around providing universal health coverage, and that's really where we're wanting the thinking to go here. What's the best way to try and provide the best care to as many people as possible, and what could we learn from different places to do that? So we're going to be piloting this in sort of October time, which isn't very far away now, really. And the idea is to, as I say, pilot the diabetes ones with these two streams, the synchronous and the asynchronous, and then to do an evaluation of that looks both at the practicalities of it. Did it work? Could you get on? Was it engaging and interesting? Sort of quantitative questions. And then getting the students to reflect really on what they're thinking about systems might do for their own practice. So students aren't going to go and change the healthcare system, obviously. It's great to get them thinking about that, but it's not within their gift to change it. Whereas what they might be able to do, what they can do, is to change their own practice. So how might they now start to interact differently with someone when they're thinking about the impact that the healthcare system has on their care more? And so we want to see that reflection, and qualitatively, do those thoughts, does the sort of thinking, the learning that's happened change, you know, between people who've done that asynchronously or synchronously, and what is it that students are taking out of this kind of digital international experience? So that's in a nutshell sort of what the project is aiming to do, a bit of a sense of the sort of thing that we've been collecting and continue to collect, certainly in terms of the TBI. Thank you to the rest of the project team, Sandra, Martha, Jessica, Roma, Louisa, Christine, Alice and Bronwyn, who've been doing various bits of doing the case study collection. And hopefully, as I say, it's all coming together, and I might be able to come back and at some point in the future share actually how it all ended up and what the students thought and found of it, found the process like, and what the learning that they took away from it was, because that's really what we're interested in finding out. Thanks very much.
Brilliant, Ben. There is so much work that you and the team have done in there. Just congratulations on achieving so much in that collaboration. I wonder if we can just open the floor briefly for a couple of minutes before we head into our trade show for any questions or comments from the team. Just see if there's, can't see any in the chat. Suzanne.
Yeah, I got a question, or rather a thought. I was a bit, you were talking a bit fast in the beginning there, so I had some trouble getting it all. But as I understand it, you haven't done the pilot yet.
No, yeah. So as I say, there were a number of things which have basically pushed the project back in one way or another. So we're at the point of sort of having the diabetes cases recorded, and we're just putting together the learning resources to pilot it in sort of October into November. Yeah, that's where it's at.
I find it's very, thank you very much for a great presentation overall, and it's a very interesting project, I think, because this will give us a possibility to let students have a sort of an insight about different healthcare systems in the world, I think. So the collaboration is amazing, I think. It's really impressive. And how do you actually, that's a whole other question around the whole thing, but how did you get money to do it?
So the money came from Universitas 21 through the Global Education Enhancement Fund. So it was one of the projects funded through that, and then we shared the funding out between the different institutions. Yeah. What you can see, even just from the two clips that I showed, is that because of a number of factors, what we've ended up being able to record actually looks really different from each of the institutions. So the video from Tech de Monterrey is fantastically edited, and it's just they've just done an absolutely wonderful job. And then because of some of the problems on the legal side, the advice we took around having people talking about their own healthcare experiences in the UK, we've had to only use audio, and so that's why ours is presented in a different way. Other ones, because of lockdowns that have been happened, we've got conversations that we've recorded on Zoom. So it's ended up with a much more mixed bag, I think, of ways of recording, but I don't think that takes away actually from the patient stories, which are what the key thing is to capture.
No, I don't think that either. And also I have a last question was, or rather it's two questions that came to my mind, and did each interviewer ask the exact same questions?
Broadly, yes. So we had a plan, and we had sort of the question topics. We weren't. It was more of a sort of semi-structured approach, rather than asking exactly the same. And I think that again, that's probably one of the things. And we were maybe being a bit idealistic here. That's ended up pushing it slightly further back is wanting to wait and see what people talked about to then inform kind of which things we've focused on for that condition, and because people did end up going in, giving much more information around often things like diet and changes that they've made there, whereas some of the more kind of medical aspects of care, it's as I say, it's quite similar, and people are able to give that info. It's quite sort of factual information, so that's we've ended up spending more on that. Yeah,
there was such a difference between the two cases that you showed us. So I am due once a year, and the other one was like more productive. She was telling us more about her situation, which will give the students so much more to talk about and so much more to sort of react to. And then my last question is, which students is it for? Is it medical students, or
yes,
and what year, or can physio students use it as well?
Absolutely. So the aim here is that it's interprofessional. So I probably wasn't as clear enough on that actually.
Probably missed that then. Yeah.
So certainly for the synchronous discussion, we're wanting an interprofessional discussion first within the university, and then an international discussion afterwards. And the aim here is essentially that we're trying to produce some teaching resources that would be accessible and open to anybody within Universitas 21. So the idea would be that anyone in any healthcare program could pick it up and either use all or part of it, and either use it just within teaching sessions for yourselves to kind of to take out some of those patient stories, or to have some like potential activities that you could do if you had a link with another physio program elsewhere, that you've already got a sort of format that you could follow, which then gave you some facilitated discussion topics if you wanted to have that sort of two-way discussion between the group. So that's the end point, is that there's a sort of e-learning package that anyone from U21 can access, and then some sort of suggested activities, some of which are synchronous or some of which are asynchronous, that you could get your students to do attached to it.
This is great. I think this is going to be available for many people and useful for so many, since we are going to use virtual exchange in a more sort of wider way than we did before due to what we learned during the pandemic. But so I find this really interesting and inspiring. And I'm looking forward to read the article coming out of this. So at the end.
As am I.
Good luck with everything. Yeah, thank you very much.
Thanks.
Well done. Yes, thank you, Ben. And I echo Suzanne's comments that this will be a really valuable resource. We look forward to being able to access and integrate into our curriculum and to report back and perhaps be part of the evaluation strategy as well. So thank you, Ben, for generously sharing all of that information. And also I can see Jess is on board as part of the research team, project team. Yeah, hello, Jess, welcome. So that's actually probably a good segue, Suzanne, that you mentioned about moving into the future in our COVID world and some of the more digital strategies that we have been adopting and will continue to. So I will now head back to our main slide deck, whereby we'll be launching into our trade show. So you'll see the presenters listed on this front slide, and I've included a slide from each of our wonderful speakers, and the challenge is in a 5-minute timeline per speaker. In this order, we'll work our way through some tips and tricks, reflections from our digital learnings as we forge on confidently with this new toolkit. And I did think afterwards that this toolkit I have here, all of the bits of tools seem to have big smiley faces, and I'm sure that whilst we have found some positives throughout our learnings in the COVID challenges, there have certainly been some jumbly times which have been pretty testing for us as educators and for our students. But all the same, we forge on with the smile on our face, and we look forward to hearing about some of those strategies. So I'll head now to Emma Beckman from the University of Queensland, who is our first sharer of the trade show. So Em, over to you. Thank you.
Thanks, Ali. I need to apologise on a few fronts. One, I've come from the gym, so not looking as professional as Ali. It is 6 o'clock in the morning here. But I also want to say thank you to Ben, because I'm very distracted now. I've never seen the Global Burden of Disease Hub. And I am like, this is what a tool for my teaching. So I've learnt things already this morning, and I'm very grateful for that so far. I guess to share a little bit of my learnings over the last 18 months to 2 years. You can hear me all right, can't you, Ali? Yeah, good. I think the thing that I learned when the pandemic hit and we had 1 week to go virtually, and it's been pretty much that way ever since at UQ, with a smattering of practical courses being back on, is that students have very short attention spans. So when I decided to just flip my classroom and record my 3-hour lectures and then just put them up on the internet, it surprised me that students weren't really interested in 3 hours worth of content all in one hit. But there we are. So what I've tried to do over the last 18 months is really split things into chunks. And I think it's really improved my teaching, because I've started using Adobe Spark, and I think I shared that last year with the group, but I'd be more than happy to put up some resources with Spark. But I've found that students respond really well to small chunks of information. So 5 to 6 minute videos, and it makes me concentrate on my teaching. It makes me chunk important pieces of information together and deliver it really succinctly and really clearly. So I think sometimes when I was given 3 hours to perform or deliver a lecture, it does feel like performing, deliver a lecture, I tended to ramble, much like I'm doing right now. So I think when I'm forced to put my thoughts into smaller chunks of information, students have actually responded incredibly well to that. The other thing that I've really struggled with, but I've absolutely learned, is that there's a balance between getting students' engagement online and facilitating good online discussions. And I think a lot of my colleagues have been blaming the pandemic, saying students weren't coming to lectures anyway, but they never come to the Zoom classes, and it's all academia is all falling apart. But I think what I've found is that the online or external engagement has actually allowed some students to engage with lecturers that they previously wouldn't have done. So a lot of our students actually travel over an hour to get to our campus, and being able to access a lot of our classes virtually has actually improved their attendance and their engagement with the course. So I think even when we can go back to more fully online, that's absolutely a learning that I've taken away. I think one of the big things, the last thing that I'll touch on for me has been, how do I get students to turn their videos on? They sit there, I'm talking to a blank screen, no one's interacting, I can't see any beautiful smiling faces like Ali's, and it's actually really difficult to engage with students when all you're faced with is a blank screen. And I've struggled with this for a little bit, but I think I've come to a little bit of a balance where part of me's realised that not all students can turn on their camera in online Zoom sessions. And I think we have a little bit of bias, and we have a little bit of expectation that potentially we need to check at the door and make sure that we're not disadvantaging students who don't have access to good technology, who have terrible bandwidth, who don't have cameras on their computers, or who are in shared spaces. They might be living with their parents and feel really uncomfortable about the family environment around them. So I think part of me has actually just become a little bit more confident and comfortable with the fact that it might not be because they don't want to engage with me that they're not turning on their cameras. I have picked up a few little tips and tricks though, and I've tried to put some photos down here. So what you'll see is that there's a Zoom screenshot capture of me in 3 different scenarios. And this is, I got a great tip from our innovation director in our faculty, where he gets students when they're at online Zooms to put up a background to respond to questions. So he asks students a question, and if they agree with it, they make their background green. And if they disagree with it, they make their background red. Or he asks them questions around, you know, give me something that you talk to your clients about in downtime to try and build rapport. So one thing for me is my beautiful little puppy. So I put that photo up as a background to give an indication that, you know, I'm engaging with the content, I'm listening to the questions, and that I'm there. The thing with getting them to change their backgrounds is that they are required to put their cameras on. So it's a little bit of a sneaky trick, but I've actually started to find that it works really, really well. So I guess I just wanted to present a few things that I've learned in terms of my own bias around whether students can and should and how they should engage, and the learnings that I've taken away with how I can better engage them with my teaching. Thanks, Ali.
Brilliant, Emma, perfectly to time as well. So we'll hold over any questions to the group discussion at the end. Thanks, Em, for the great insights. And I'll now hand over the baton to Lynn from Johannesburg. So Lynn, welcome aboard and off you go.
Thanks, Ali, and thanks, everyone. I also have to just start off with an apology, just as Emma did. My twins have just woken up, so you might hear a little bit of noise in the background, so I do apologize for that. But just to start, I think if not before, the pandemic has taught us that many academic goals can be supported by online learning, blended learning, and digital learning. I believe there are 3 key facts that we all need to consider when we develop different ways in which to use technology in our teaching. And the first is to ensure that our students are engaged. That's first and foremost. Secondly, we need to ensure that learning is enhanced, that value is added to it, and that quality is not compromised. And lastly, that learning should be extended beyond the classroom in unique ways. So having said that, technology integration should be driven by good teaching practices and not fancy tools per se. And the discussion board that I'll be talking to today is nothing short of simple, yet effective. So to simply define the discussion board, it is a communication tool that allows students to collaborate with each other and also answer questions that have been posted by the lecturer or other students as well. I find that this is great, especially in this, when we, you know, if a student asks a question and I'm not particularly available at that time, you know, other students are able to answer the questions, and in that way they learn from each other. So there are quite a few advantages of the discussion boards that have proven to be quite effective, during the remote emergency learning phase that we've just been through. But I think it can be quite effective for use in many, if not all of our modules in the post-pandemic phase. So firstly, I think it's quite an effective way of assessing students, especially for those, like Emma mentioned, who are not comfortable participating in online live classes, because their mics and videos do not need to be switched on. Especially important in a country like South Africa, where access to the internet and decent bandwidth, it's actually considered to be a luxury for many of our students. So the discussion board allows for all students to participate equally, without disadvantaging some of them. The second advantage is that the discussion boards allow students an opportunity to jot down their thoughts. That's great, because not all students are able to express themselves verbally as well as others, or as well as they are on paper, for example. And then thirdly, if settings permit, based on the lecturer's preference, students can edit their responses even after it has been published. So this will allow for better grades, especially if you are using the discussion board for assessment purposes. So how it works is that the lecturer will start a conversation by creating a thread. And in the example on the top right of the slide, you can see that 2 articles have been published on exercise and AIDS, which is very relevant in South Africa, and as well as exercise and cancer. So that was made available to students as part of an assessment. And they were then given an opportunity to respond on how they would approach and manage such patients. And you can see that in the screenshot on the bottom right of the slide. But the students were also able to comment on their classmates' posts. So for this reason, because students can sometimes get a little bit out of hand, we could actually moderate the posts for profanity and appropriateness, which is an additional useful tool or useful setting that the discussion board offers. What's also great is that the discussion board allows for individual or group participation, and based on the settings that the lecturer chooses, you can then decide which member of the class you'd like to present or to participate, or they can choose themselves. The lecturer can also create rubrics on Blackboard, and that makes grading a lot easier. So when you assess, all you need to do is click on the correct block in the rubric, the score is automatically tallied, and then the students will receive their grade for participation, as well as any feedback that you'd like to give. So I think essentially what I've picked up using the discussion boards is that it allows me to assess student progress consistently, which I believe is very important. I've actually read up on quite a bit of work on the co-founder of Teach United, which is, and that is Heather Hebsch. And she's actually committed to serving teachers in the public education sector. And that's similar to the institution, to the University of Johannesburg. It is more public than private. And she believes that teaching and monitoring student progress should be like taking a temperature instead of doing an academic autopsy, which I thought was, quite a saying that really stuck with me. I found it to be particularly useful to ensure student success, especially in unpredictable times, and especially because these times are quite overwhelming for students as well. So if any of you teach at an institution that makes use of Blackboard as the learning management system, because that's where I use the discussion boards, I'll be happy to assist you if you require some guidance. And I'm also willing to chat about innovative ways in which we can mimic the discussion board if you don't have a Blackboard forum. And that's it from me. So thank you.
Brilliant, Lynn. Thank you. Great to see what we might consider, as you said, part of a fairly simple tool used in a really effective and engaging way. So we'll look forward to some questions and comments at the end. I'll hand over now to our next presenter, Javiera. Thank you for your time. Off you go.
Thank you, Ali. Well, in our university in Chile, the change to remote teaching began a little bit before the pandemic, because here in our country, we started a social crisis in the second semester of 2019. So there, it was difficult to attend some in-person activities. As in other health professions, our major concern was the difficulty of having face-to-face attendance for learning clinical competencies and also practical skills. So we started to look into the remote simulation as an alternative to train some skills remotely. And there we found the U21. U21 is a startup of our university that was originally designed to train surgical skills in postgraduate medical students. But this platform allows students to upload videos demonstrating procedural skills. First, students watch a video of the intended skill. Then they record themselves performing the same skill from home, using some friend or some parent as the model or the patient. They upload the video, and then teachers or instructors provide multimodal asynchronous feedback on the same video. As you can see in the images, we can provide audio feedback, written feedback, or we can draw over the image of the video and provide some specific input of the skill. So U21 is highly recommended from us to you as a platform to give some individualized and specific feedback, and to keep training the procedural and clinical skills in our students during the pandemic. Next, please, Ali. And when we gradually returned to campus, we used technology to stream our classes, because there were some students that cannot attend the classes because they live outside the city or because they were infected. So that way we could involve everyone who could not attend. And also students use the artistic skills to create their own mannequins to practice pediatric skills at home or at campus. That is also a thing that I recommend, because they can have their own phantoms and train their skills in their home. That is Ali, our experience from physiotherapy.
Well done, Javi. Thank you so much. I'll just reset the stopwatch for my final show and tell as part of the trade show. So I'm from physiotherapy, and my area is cardiothoracic physiotherapy. So I'd like to share a couple of key learnings that I'm hopeful maybe one thing that you're able to take away. And it actually is a nice continuation from Javi's comment about making the do-it-yourself pediatric mannequins. In my context, I was aiming to encourage students to be able to make their own thorax. So we called it affectionately the pillow patient. And this was using bits and pieces found around the home. So knowing that students during our lockdowns were not able to go out and purchase anything. So I needed to find things that were readily available, no cost, and also that were available to those students who were in hotel quarantine, for example. And this provided the parts of the body that we required for the cardiothoracic assessment and treatment techniques. So you'll see on the top pictures there that really to create the thorax, we had a pillow with a wire coat hanger, and the wire coat hanger could be fashioned into some ribs for the rib compliance for the techniques, and also into a sternum. So we got got some of the surface anatomy landmarks with the sternum, subcostal angle, etc. And as soon as you place a shirt onto a pillow, it's amazing how instantly that then becomes like a thorax. And again, the surface anatomy landmarks with the shirt, we get the clavicles at the collar, the axilla with the armpits of the shirts. Of course, using the arms of the shirts, we then get some upper limbs to assist with supported coughs and some other techniques for placement. And then with the lower limbs for many of our assessment techniques like circulation, pulse checks, and some of the strength measures that you can see in the photograph of some of my students performing their techniques in one of our Zoom practicals. This really was a wonderful way of engaging students in our remote, I termed it synchronized simming. So it was a bit of like synchronized swimming, sink or swim, but we certainly leapt in and had a go, and we were able to do some brilliant real-time simulation for those students who were able to be on campus, live streamed synchronously with those students at home, and creating that sense of connection and engagement for the students as a cohort. So that's probably my first learning, was that low cost can be high value, and that students can be really resourceful, and often they'd come to the table with their own things that they'd found around the home that could replicate some of our cardiorespiratory techniques and specialized equipment. For example, using shoelaces as suction catheters, or using headsets as stethoscopes, not headsets, but earphones as stethoscopes, and practicing the positioning and all of the psychomotor skills. Something else that I discovered is called H5P. It's a fairly unsuspecting name for a really great digital toolkit of creating online virtual interactive activities for students. So for example, in the photo in the middle here, you can see that in the class on campus, we have specialized respiratory devices. These are not in the home environment, but by creating this online, this was a really simple drag and drop activity that I created, whereby students at home in real time with those in the classroom were selecting the appropriate parts of that device and dragging it in assembling that device in the order that they would do that if they were in their classroom. So that familiarization, and that really helped when those students did return or were able to arrive onshore to campus, the learning had been accelerated. So as soon as students then saw these devices in person, they were able to immediately pick up with the learning and the application. So the H5P was excellent in terms of helping to bring specialized devices into the home, but also the specialized learning environments that we have on campus, that we don't have a simulation ward conveniently at everybody's home. And although we were creative in turning couches into clinics, and as you can see, pillows into patients, I would aim to have these like this virtual tour of our simulation ward that students can actually move around, again, using H5P, clicking on their bits of information to help immerse students in the environment and help them to become familiar and comfortable, again, expediting that transition when they arrived on campus. Other very basic approaches, just like a weekly welcome video that I would broadcast from the learning space where possible, to help students who are offshore with that sense of connection to campus and to their peers and to the space that we were learning in. So really just summarizing some of the toolkit things, we're using items around the home, and the other big shout out to the H5P, which I discovered was very versatile and easy to learn. However, of course, that this doesn't come without some cognitive load, but really being experimental, improvising, having a sense of humor, and being flexible go a long way in some of these challenging times. So I'll stop my 5 minutes there. And so what I will do is I'll stop sharing the screen, and I'll just bring everybody up for our final part now, which will be just about 5 minutes of any Q&A or discussion, any comments about things that maybe resonated for you from any of the speakers. So I'll see if there's any initial questions.
I have a question, because we've been through the same thing all over the world in a way, and we had different solutions, and we have different sort of circumstances as well. In Sweden, we didn't have a lockdown, as you know, and so we were able to have our students at campus during those manual skills things, and we put them in smaller groups, and they had masks and what do you call those plastic things on as well,
Fields, I think. Shields.
Shields, thank you. So they were able to do that, but all the lectures were online. And what I wanted to ask you now is, did you actually, when you did the exams at the end of the semester or at the end of the course, what was your experience of the level of learning? Did you, if you compare it to the regular, ordinary times, was there a difference? Because I think there was. Do you understand what I mean? What I'm looking for?
It's a great question. I wonder if anyone would like to jump in. Em, did I see you shuffling your seat there?
It's a really good question, Suzanne, and I think it's complicated by the fact that I think our students did better on assessment, but that's because the assessment changed. I don't have a really good benchmark of the students learning over the last sort of, it's almost back to normal, and it's the grades and the outcomes of the assessment pieces are fairly similar. But because during that time our assessment changed so much, I don't have a good benchmark of the learning versus the outcomes. But I'd be really interested to hear other people's thoughts on that too.
Javi, would you like to share?
Yes, well, our grades are much more higher than before in all courses, but now, Susan, we are now realizing some gaps that they have now when they enter to the clerkships, to the clinical placements. So now we are realizing that they have some gaps in some clinical skills. So in the moment we didn't realize it, but now we can notice.
That's a great reflection, Javi. And Ben?
Yeah, I was just going to come in on that and say one of the things that we've noticed was, so we had practicals that we carried on with, but in smaller groups. So students really only worked with the same person for the whole year.
Yeah, we did the exact same. Yeah.
And so then when it came time to do an exam and it be somebody different, or now they're going out on placement, actually that's felt like a real gap, that they're just not comfortable. You know, you can see the anxiety goes up when it's somebody different, and so that's one of the things we're not, that's not the plan. So we are going to be mixing as we normally would from this semester, and I think that is an important thing to get back to. It's some of the sort of, you wouldn't have thought, it's not the clinical skill as much as just the interpersonal and those sort of softer elements of it, I think that our students seem to be lacking.
Interesting.
Yeah, great observation, and really great stimulus question, Suzanne, and likely one we could continue a whole session talking about, no doubt. Maybe
I actually think so. And I think if we do an evaluation after this time, we will find that students have actually good knowledge in certain areas, but really weak knowledge or low knowledge in other areas. And for my part, I can say that I think that in my course, some of the students their learning or the level were more superficial than it usually is. So I think the interaction between teacher and students, the group discussions outside of the lecture room that they didn't get at this time sort of disturbed their way of learning, and it sort of stopped them from learning the depth of the topic, I think. So that's a little minus, but there are other things that actually shows us a plus, but still we do have to learn something from this. And yeah, there are gaps, I think. Yeah.
Great reflections, yes. And I'm just mindful we're in our final minute of our session together, and time does fly when we're having fun and reflecting and looking forward to the future. I'll just very briefly head back to my slide just to do our summary and to thank our core group for the activities throughout this year and the engagement and for the collaborations. Please feel free to be in touch with either myself or with Corinna. But again, acknowledging the presenters today, and Ben, thank you for your time. We'll look forward to being actively engaged with you, Ben, along the way as well, and to hearing more, and to the presenters today for all of the learnings. And thank you to Corinna for helping keeping us on the path as we prepared for today, and also to the Tech de Monterrey team behind the scenes for the wonderful support with the setting up of the Zoom links and helping this session to run smoothly. So right on time, we'll draw to a close, but I'll stop share, and perhaps if you're comfortable to unmute and turn your camera on to do a wave and a hello, goodbye, happy day, happy night, whatever it might be where you are. And thank you to everybody.
Can I just do a screen dump?
Yes, we should do our virtual group photo, which good thinking. If people are comfortable to be part of.
Yep. If you don't want to be in the photo, you don't have to. So I'm just gonna try see if I can fix it. I'm not sure it's working though. Hold on.
I'll take Suzanne, if you look up.
Didn't work. Have you done it?
I'll do it with my camera and send it on. So yeah. 3, 2, 1, cheese. Wonderful. There we go. That's our new aged group photo. Well done. Well, thank you. Yeah, excellent. And happy day, whatever it brings, evening, sleep well.
Thanks, everyone.
Thank you very much.
Thanks, everyone.
Thanks for a great session, Alison.
Thanks again, Ben, Suzanne. Thank you. Javi, thanks. And
look at my pals, my very best friends there.
Look at them. Gee, they've grown.
Hi, girls.
Yeah, they're big now.
They're gorgeous. Hello. What time is it for you, Jess? Where are you?
I'm in Melbourne, so it's 7.
7. Oh, you've done well.
Yeah.
I'll wake up time. Brekkie and peak hour, I'm sure, for the.
Oh no, I've done really well. They've stayed asleep until now.
Well,
Lynn, do you also have twins? Lynn?
Lynn, yeah. Lynn.
Yes.
Yeah.
Yes.
And lovely.
Lynn, was yours a midnight wake up? What time is it for you with the kids waking up there?
It's 11 p.m. now.
Oh, they just heard all of the excitement and came out to have a look.
So I'm going to wave now. Hi, cuties.
Yeah.
Good morning. Oh, that was wonderful. Thank you so much, everybody. And
Thanks, everyone.
Yeah, Jess, great to have you here too. Thank you.
Yeah.
Wonderful.
So good to see the girls. Yes.
Yeah, well, that was good timing, so we just hijacked the end of the meeting, but yeah.
No, that's a pleasure. That's
okay.
one of the benefits of Zoom. We can be in people's homes as well. Let's see beyond the usual conference. Well, thank you. And I know it's very late for some of you, so off to bed, cup of tea and feet up. And wonderful. And Corinna, thank you as well. I know we've worked very hard, so brilliant. We'll keep in touch, and
all.
the recording will be on the U21 website, so we can check that out and share that around too.
Take care, everyone.
Take care. Thanks again.
Everyone.
Bye-bye.
Bye-bye.
Bye.